Chris Kelly here with EFT Tapping Solutions. Today I would like to discuss briefly, because I don't want to get off on a tangent or a rant, discuss briefly pain science and EFT tapping. Okay? So what is pain science? Well, that's the study of pain. And it's a huge topic, and it's extremely detailed and has a lot of different facets to it. But what I would like to talk about first is that if you have acute pain, I'm talking physical pain, you need to go see your doctor, okay? See your medical doctor, your osteopath. Do what you need to do to take care of yourself first, okay? I am not a doctor. I cannot advise you to not see a doctor or anything like that. But when it comes to EFT tapping, and what I want to discuss today is that if you have chronic pain, which is usually pain that's lasting more than 3 or 4 months, it probably has ties, your chronic physical pain has ties to unresolved emotional issues. Okay, that's really the crux of this video today, is chronic physical pain that's been lasting, more than several months, probably has negative emotions tied to it. And that's what we do with EFT tapping here, is we get rid of or we eliminate those unresolved negative emotions, okay? So let me give you a little brief history in regards to myself. I've been a medical massage therapist since 2003. I've worked with 2 different chiropractors and an osteopath for about 5 years. So I'm pretty well versed in working with healthcare and health and wellness professionals, okay? I've seen massage work wonders. I've seen chiropractic work wonders, acupuncture, pills from medical doctors, physical therapy. All this stuff is great. So if you think you need to go see them, please do. I'm not advising you to not see them. But over the years of my practice, what I've seen is a lot of people with physical pain that you work with them, you do massage with them, you do movement therapy, you do chiropractic, and they're just not getting 100% better. And that's where EFT tapping comes in. EFT tapping, again, works with the mind and the body, and they're together. Now, a lot of these other forms of therapy, they work with the mind and body as well, and I'm not criticizing them or anything, but this is the beauty of EFT tapping, is it works with the negative emotions or unresolved emotional issues. So I want to kind of hammer that into you and then just cover a little bit in regards to how our central nervous system works in regards to pain science, okay? You have sensory nerves in your body, to where if you burn your finger or smash it, those sensory nerves pick it up at the physical body, send it into your nervous system, and it says, ow, that's where pain is. And if you have acute pain, which is, it happens right away, and you hurt your back or you smash your finger with a hammer or something like that, yes, you need to seek professional medical treatment, okay? Yet, if this persists for months at a time, and you think that it should have healed by now, and you possibly don't have tissue damage, because tissue damage is not always linked to chronic pain. So let me say that again. You don't have to have tissue damage to have pain, okay? There's phantom limb syndrome, where people have lost their arms and legs and still feel them and still feel pain in them. So what we're talking about is eliminating the negative emotions that are tied with this. Because after a month or two, you think some pain should go away because it looks like the wound, whatever you have, it looks like it's healed, but you start worrying about it. And then this activates your immune system, it activates your endocrine system, it elevates your stress hormones and things like that. And now you have cortisol pumping through your body and you're stressed out about it, saying, boy, my knee should have been healed by now. And now you start to get these negative emotions. Or it could go back to your childhood traumas and dramas and different things of when you're a child, and it activates those emotional issues. And that's what we're dealing with EFT tapping, okay? So this is just a short, quick video, and I'll do a little tapping here real quick with you just to try and relax the sensitized nerves, because with chronic pain, you have a couple things going on. Usually what you have is that the muscles spasm and they tense up. And what that does is that kind of restricts the blood flow to an area, so it can't get oxygen into the injured area, and it can't remove waste. And then what it also does is it sensitizes those nerves. They're very sensitive. And then you have negative emotions on top of that, to where you're worrying about it, and that makes you feel worse. So your thoughts definitely influence your pain, and your thoughts influence your body. So let's just do some real quick tapping. This is a real, instructional tapping video today. It's more about me trying to explain to you without going into a tangent or a rant, which I can easily do, and I can talk your ear off for another 30 minutes in regards to pain science. But the biggest thing is what I want to discuss with you is just the mind affects the body. And it controls the body, your central nervous system, and your mind, and pain is an output of your mind and your brain. And I'm not going to get into all of that, but I just want to have you think about that, okay? So just think about that a little bit, that just because your knee's hurting, there might not be tissue damage in there. Go to the doctor, get your x-rays, MRIs, all these things like that. But it might not, I'm sure if you've been in chronic pain, you've had all the tests and taken all the pills and do everything, and it's still not getting better. So it could be emotional ties. So let's do some tapping that, even though I have this lower back pain, I love and accept myself completely. I accept myself completely, even though my lower back hurts. I love and accept myself completely, even though I got this chronic, persistent low back pain. And then we're going to tap through the points, this low back pain. My back really hurts. My back really hurts. Back hurts. My lower back is hurting. Lower back's hurting. Lower back's hurting. Lower back's hurting. And just tap through that, okay? Try and desensitize and relax your central nervous system to where it's not freaking out and you're not worrying about it. And then when you're tapping through the points, start voicing some of the concerns you have. Is this pain serving me? Why is it serving me? Is this keeping me out of, my obligations? I don't want to go do things, and I'm using pain as an excuse. I'm using my pain as an excuse. I have negative emotions every time I think of this pain, and then just start talking your way through it, okay? That's the beauty of tapping, is to be able to tap through and to voice what your concerns are in your head. So just go ahead and tap through those. But the biggest thing, like I said with this, is unresolved emotional issues affect the physical body. So I'm going to do a chronic back pain tapping sequence here, and we're going to tap on anxiety, and we're going to tap on phobias and different things like that. But I wanted to create this video first because I wanted you, and I really want you to focus on this, is to understand that, just because a certain part of your body hurts, that might not be where the pain is. The pain's coming from up here in your mind, okay, with the worrying about it and your negative emotions. So I'll let you go for now. Chris Kelly with EFT Tapping Solutions. I'll talk to you later. Have a great day.